Welcome to page 37 of Anatomy Coloring Book. This is Dr. Stephen Harkins. In this lesson, we'll talk about the sacroiliac and hip joints. We have briefly discussed them. Of course, sacroiliac joint is between the sacrum and the ilium. Is this joint right here, where these two bones meet, the sacrum and the ilium. Here you can see the surface of the sacrum, the joint surface of the sacrum, and it will match up and pair up with the joint surface of the ilium. Here's another view here, a transverse slice. I'm looking down from the top, sacrum here, and the ilium here. The sacrum and the ilium and the space between. Actually, better to remove this here. There you go, the space between the sacrum and the ilium. And looking at this sacroiliac joint, there is an anterior portion. This is the front, and this is the back, posterior. So this is the behind, and this is the front of the pelvis area. There is two parts of the joint. One, a typical classic joint with hyaline cartilage here, and this is called auricular cartilage because this area looks kind of like the shape of an ear. So it's called auricular cartilage. Here's an ear shape here. Then there's the back part of the joint, or the posterior part of the joint, which is not smooth and slippery and filled with hyaline cartilage, but rather connected. It's rough. These are rough little edges of the sacrum here and of the ilium, and attached by a ligament, not the anterior sacral ligament. This would be a posterior sacral ligament. So attached by the posterior right here, and interosseous sacroiliac ligaments. Interosseous meaning between the bones. That's the area in the middle right here, between the bones. The interosseous sacroiliac ligaments, and then the posterior on the back. And of course, this is an expansion and a cutout, as I said, not transverse after all, because of the tilt of the sacroiliac joint, but instructive nonetheless. And you can see on the front here, the anterior sacroiliac ligaments. So anterior sacroiliac ligament, posterior sacroiliac ligament, and the joint, the two parts of the joint, the sort of slippery auricular hyaline cartilage part of the joint in the front and the anterior, and a more fibrous joint in the back, or ligamentous joint. And again here, the auricular or ear-shaped fibrocartilage on the front part of the joint. And this is all taking place right in here, in the front part of the joint, right here, the sacroiliac joint. And then the back or posterior part of the joint would be this right here, this ligamentous fibrous part of the joint right here in the posterior. Okay, I made a mistake here. These were referring to not to the sacroiliac cartilage, but to the hip cartilage, the hip bone. So let's move on to the hip bone here. Actually, I stand corrected. I had it right after all. We are referring here to the sacroiliac joint in these cases. And here, the synovial cavity is referring to the joint space in between the auricular sacroiliac joint, auricular portion of the sacroiliac joint. So It's meaning a synovial cavity, meaning it has synovial fluid, meaning it has very slippery cartilaginous surfaces that smoothly move against one another. And the interosseous spinal sacroiliac ligament, is right here we just went through, and that is this term right here, interosseous sacroiliac ligament. Moving on to the hip bone, the hip joint. So we've been referring to the ilium as the hip bone. The hip bone. And we have previously discussed the acetabulum. The acetabulum is this great space right here, this cavity, this concave area that is the space that accepts the head of the femur. So that is called the acetabulum. The acetabulum. Now, the acetabulum is not a complete circle. It is more of a shallow concave area. And what completes it and rounds it out and extends it is what's called the labrum. The acetabular labrum. Right here. And what it does, it's a form of cartilage that extends past. So it's not hard bone like the acetabulum itself. It's softer. And it's this little area right here. And just inside the acetabulum. And it actually extends out and thickens. And it's sort of a lip. It kind of lips out beyond and creates the fossa and makes it a little bigger and less shallow, so that the hip fits very snugly in there. So it would look something like this. The acetabular labrum kind of projects out a softer cartilage here and sort of keeps the femoral head nice and snug inside the acetabulum. So acetabulum and acetabular labrum. Further lining the acetabulum is articular cartilage. And then a layer of synovial membrane on top of it. There's also a curious little ligament inside, coming sort of out of the articular cartilage, called the ligamentum teres. And it comes out of the pelvic bone or the hip bone, onto the head of the femur, and there are vessels that travel through there to nourish the head of the femur. And here we have a diagram, and up close, here's another look at the ligamentum teres, proceeding out from the pelvis and into the femoral head, protruding through the articular cartilage of the femoral head, femur. Of course, here's the articular cartilage on the side of the pelvis. We have the pelvis here, and the hip bone here. And of course, the acetabular labrum is that little extended piece of connective tissue that extends out beyond the acetabulum, the bony acetabulum of the pelvis. Here's the bony part of the pelvis, bony acetabulum. And there's the labrum in green, sort of extending and making an even deeper fossa for the hip bone, for the femur head to rest in. And of course, inside, in between these two spaces, is the synovial cavity with the synovial fluid. And the joint capsule, of course, is the surrounding ligamentous type tissue that encapsulates everything and keeps it nice and snug in there, and keeps the synovial fluid in there, inside the hip joint. And this represents the end of page 37, sacroiliac and hip joints. This is Dr. Stephen Harkins. Until next time.